We're going to name this chapter, You Got This, because you do. This is going to be the most difficult chapter in our Understanding Medications course, covering just about the most difficult topics in pharmacology, but you're going to rip through this chapter in less time than you did in our other chapters. In this chapter, we're going to discuss neurotransmitters, drugs that affect neurons, emesis, or in other words, vomiting, and also the drugs that affect emesis, or in other words, the antiemetic drugs. And you may be thinking, well, what does neurotransmission have to do with vomiting? Doesn't that occur in the stomach? Well, vomiting occurs from the stomach, and in some instances, the problem originates from the stomach, like there's bacteria proliferating out of control, but the actual controlling portion of our body that controls emesis is in the brain stem, specifically the medulla oblongata. And it's really quite complicated, using 4 different neural pathways and several different neurotransmitters. But don't worry, you got this. So what's our first step? We're going to first aim to get a really good picture of neurotransmission and how our medications can work on neurons. And just after that, we're going to apply that knowledge to other medications that work on neurons but outside the digestive system. And since we're going to be talking about vomiting, it's best to take some of the safety issues about the condition itself. So we'll get a broad picture of the red flags that are associated with vomiting. Then we're going to look at the normal anatomy and physiology of the tissues involved. And as we always do, we're going to get a good idea of the pathophysiology, or in other words, deranged physiology. But in this case, vomiting is not a pathophysiology. It's a normal physiological response. And it would be abnormal if we did not vomit in certain instances. And with that, we can see exactly where each of our antiemetics work. And finally, we'll look at some of the specific issues around the most important antiemetics. To be clear, there's a couple types of treatment for nausea that don't work on neurotransmitters. They have direct actions. Can you think of any of those? We just learned that most of our medications that aim to decrease nausea and vomiting work on neurons, blocking neurotransmitters. But there are a couple examples that work directly. So did you think of any of those that may work directly? One of the most common is bismuth subsalicylate, also known as Pepto-Bismol and by other names. Because of the fact that it doesn't work on neural pathways, we don't consider it an antiemetic, but it may be effective in reducing some of the nausea and vomiting from conditions that involve mild inflammation of the stomach. Although the impulse for vomiting comes from the medulla oblongata in the brain stem, the nerves that are being directly affected in the case of irritation to the stomach are within the enteric nervous system of the gastrointestinal tract. Bismuth subsalicylate has several direct actions in the GIT. It has local anti-inflammatory effects, it decreases stomach acidity, and it has direct antibacterial effects as well. And with those actions, it is possible that it will soothe the stomach enough to relieve mild irritation in the GIT. However, if there's severe irritation in the GIT, we need to treat that at the level of the neurons, as we'll see later in this chapter. And right now, we're going to get a good picture of neurotransmission and how our medications affect neurons.